After studying this module, you shall be able to know what does the term panic disorder actually mean? What are the signs and symptoms of panic disorder? What are the causes of this disorder? What are the different types of panic disorder? And about the effects and diagnosis of panic disorder. In the last module, we have learned about bipolar disorder. Bipolar disorder, which is also known as bipolar affecting disorder, manic depressive disorder, or affecting psychosis, is a mental illness characterized by periods of elevated mood, followed by the periods of depression. Symptoms of bipolar disorder are severe. They are different from the normal ups and downs that everyone goes through time to time. The elevated mood is significant and is known as mania or hypomania, depending on the severity. During mania, an individual feels as acts abnormally happy, energetic, or irritable. They often make poorly thought out decisions with little regard to the consequences. The need for sleep is usually reduced. On the other hand, during periods of depression, there may be crying, poor eye contact with others, and a negative outlook towards the life. Other mental health issues such as anxiety disorder and drug misuse are commonly associated. Bipolar disorder is characterized by transition between depression and mania. Now let us learn about panic disorder. Panic disorder is an anxiety disorder characterized by recurring severe panic attacks. People suffering from panic disorder have sudden and repeated attacks of fear which may last for several minutes or even longer. They are also known as panic attacks. Thus, panic attacks can also be defined as the attack in which there is sudden gush of overwhelming anxiety and fear. Other symptoms also include certain behavioral changes which may last over a month or ongoing worry regarding the implications of concern having another attack. The concern of having another attack is also known as anticipatory attack. A person may become anxious, worried or tensed thinking about when the next panic attack will occur because these attacks cannot be anticipated. These attacks can occur both in children or in adults. The attacks are described by losing of control, while there is no real danger or even by a fear of adversity. A strong physical reaction may be shown by an individual during a panic attack. As severe symptoms follow after the panic attacks, it can also be mistaken for a serious physical illness, for example, a heart attack. This misconception often results or further intensified further attacks. A person suffering from panic disorder or undergoing panic attack may feel discouraged and even ashamed because he or she cannot carry out the normal activities.
Now, moving on to the history of panic disorder. Panic disorder has not continuously been acknowledged as a totally psychiatric condition. Research in this area continued along separate medical and psychological axes until 1980 when the development of Diagnostic and Statistical Manual DSM-3 criteria established the overall idea of panic disorder. Let us move on to the signs and symptoms of panic disorder. Persons suffering from panic disorder usually have a series of intense episodes of extreme anxiety during panic attacks. Hence, the attacks can occur at any time and anywhere. The signs and symptoms in case of a panic attack build up shortly and generally reach their peak within 10 minutes. They barely last more than an hour, and most of these attacks end in 20 to 30 minutes. This disorder can be described by repeated panic attacks combined with key changes in behavior or constant nervousness of having further attacks. These attacks may also be triggered by exposure to certain stimuli, example, seeing a snake, or settings, example, the operation theater of a hospital. Supplementary panic attacks may seem unprovoked. Some of the persons undergoing panic attacks deal with the happenings on a regular basis, sometimes daily or weekly. The apparent signs of the attack often cause negative social experiences such as embarrassment, social stigma, social isolation, etc. Many individuals experience panic attacks without further episodes or problems. Occasionally, individuals suffering from panic attacks may further go on developing that into panic disorder. The advanced stage of the panic attack includes an amalgamation of the signs and symptoms as mentioned. Shortness of breath or hyperventilation, heart palpitations, pain in chest or uneasiness. Next, feeling isolated from surroundings. Next is perspiration, vomiting or unsettled stomach, feeling giddy, trembling or shaking. Next is lack of feeling or itching sensations, hot or cold flashes, and lastly, fright of death, losing control or going mad. In some cases of panic attack, the signs may become serious or continue to be of high intensity. The anxiety of panic disorder is really serious and notably episodic as compared to that of the generalized anxiety disorder. Very similar to panic attacks is the limited symptom attack, but having not many symptoms as that of panic attacks. Also, many individuals having panic disorder frequently experience both panic attack as well as limited symptom attack. Panic attacks may also last only for few minutes, but the effects of the occurrence can leave a long lasting impression. The terror and the intense fear felt during panic attacks can pessimistically impact his or her poise and may cause serious interruption to everyday life. Ultimately, this leads to the following panic disorder symptoms. First is anticipatory anxiety, defined as an anxiety of having future panic attacks. This fear is present most of the time and can be extremely disabling. Next is phobic avoidance, a tendency of avoiding situations or environments that caused previous panic attack. Taken to its extreme, phobic avoidance becomes agoraphobia. Now moving on to panic disorder with agoraphobia. Agoraphobia was traditionally thought to involve a fear of public places and open spaces. However, it is now believed that agoraphobia develops as a complication of panic attacks. With agoraphobia, you are afraid of having a panic attack in a situation where escape would be difficult or embarrassing. You may also be afraid of having a panic attack where you won't be able to get help. Because of these fears, you start avoiding more and more situations. For example, you might begin to avoid crowded places such as shopping malls or sports arenas. You might also avoid cars, airplanes, subways, and other forms of travel. In more severe cases, you might only feel safe at home. Next, moving on to the causes of panic disorder. According to the psychological models, even though the exact causes of panic attacks and panic disorder are unsure, the affinity to have panic attacks runs in families. It may be transferred onto individuals by one or both the parents, such as in case of hair or eye color. The causes of having panic attacks may also be correlated with major life changes, such as passing out from college and entering the place of work, getting married, and having a baby. Constant worrying, for example, the demise of a loved one, separation, or job loss, may also result in panic attack. In post traumatic stress disorder or PTSD patients show much advanced degree of panic disorder than the overall populace. Studies have shown that various factors, including biological and environmental, may be involved. These factors include: first is the smoking. Tobacco smoking, especially started in young age, increases the risk of developing panic disorder with or without agoraphobia and panic attacks. However, the mechanism behind this concept is not yet fully understood. A few hypotheses have been derived. Nicotine, a stimulant, could contribute to panic attacks. Nonetheless, withdrawal from nicotine may also cause substantial nervousness, which may contribute to panic attacks. Cigarette smoking may also result in panic attacks by triggering changes in respiratory function. The changes in respiratory function can further lead to the development of panic attacks because respiratory symptoms are a conspicuous feature of panic. Next, moving on to caffeine. Various clinical studies have revealed an affirmative link between caffeine consumption and panic disorder, and it was determined that people suffering from panic disorder are more sensitive to the anxiety provoking effects of caffeine, that is, increasing the heartbeat. Caffeine does two things that relate to panic and anxiety attacks. Firstly, caffeine, being a stimulant, interferes with something called adenosine, which is actually a brain chemical that helps to calm us down. We all know that panic attacks arise from situations that leave us at the opposite end to calm. So, if caffeine is affecting this process within the brain, it is obviously going to lead to more frequent and more severe attacks. Secondly, caffeine also raises our lactate levels, which are known factor in producing panic attacks. So, with our lactate levels on the rise and our calm receptors of the brain being interfered, it becomes apparent that panic attacks could be linked to caffeine. Now, moving on to alcohol and sedatives. It was found in various researches that about 30% of people having panic disorder consume alcohol and about 17% take other psychoactive drugs. Consumption of recreational drugs or alcohol usually creates symptoms unpleasant. Most of the stimulating drugs, such as caffeine, nicotine, cocaine, would be likely to deteriorate the condition as they directly escalate the signs of panic, for example, heart rate. Alcohol initially helps in easing panic disorder symptoms, but the long term usage may worsen the symptoms, especially during alcohol withdrawal syndrome due to distortion of the brain chemistry and function. Next, moving on to major life stresses, stressful events, and major life transitions, such as the death of a loved one, divorce, etc., can trigger panic disorder. Panic attacks can also be caused by medical conditions and other physical causes. If you are suffering from symptoms of panic, it's important to see a doctor to rule out the following possibilities. First is mitral valve prolapse. It is a minor cardiac problem that occurs when one of the heart's valves doesn't close correctly. Next is hyperthyroidism or overactive thyroid gland. Next is hypoglycemia or low blood sugar. Next is stimulant use such as amphetamines, cocaine, caffeine, and lastly, medication withdrawal. Now, moving on to the various types of panic disorder. There are following two types of panic attacks. First is expected panic attacks. These panic attacks are anticipated when one is subjected to specific situations and things. This is the time when panic triggers. For example, an individual having fear of flying, that is, aerophobia, may probably have a panic attack while boarding a plane during the time of takeoff or at some time in the course of the flight. An individual having fear of closed places, that is, claustrophobia, may be expected to have panic attacks when he or she is in elevator or other confined spaces. Now, moving on to unexpected panic attacks. The panic attacks take place unexpectedly without any evident cause or stimulus. When an unexpected panic attack occurs, the person, of course, remains completely relaxed before symptoms develop. This type of panic attack does not complement any conscious internal indications, for example, having awful thoughts, feelings of extreme fear and anxiety, or comfortable physical sensations. A recent study found that unexpected attacks are actually preceded by measurable changes in the nervous system. Even if you aren't consciously aware that a panic attack is imminent, your body shows subtle signs that it is preparing for one. If confirmed, the finding might cause psychiatrists to redefine the way they now distinguish what they refer to as uncued from cued attacks. Next, moving on to the effects of panic disorder. If the individual suffering from panic disorder is improperly treated or the symptoms are ignored, Its effects are devastating for both the individual along with them who are around the person suffering from panic disorder. Some of the possible effects of panic disorder are: first is disruption to normal daily activities. A person suffering from panic disorder may become depressed and feel ashamed because he or she are not able to carry out normal activities like going to a grocery store, driving a vehicle, etc. Next is alcohol and drug abuse. Panic disorders are often complemented by other severe problems, for example, dejection, drug abuse, or alcoholism. These conditions require to be cured individually. Relationship problems. Relationships suffer because people with panic disorder start to isolate themselves from the society to avoid future attacks. Next is increased suicide risk. People with extreme stage of panic disorder rarely may even attempt to commit suicide to avoid their unbearable situations. And lastly, depression. Depression is one of the most common and dangerous effects of panic attack. The depression comes from the fear of having a panic attack again or from the feeling that any out of place activity could trigger it. A person who is often frequented by the panic attacks might stop visiting certain places that cause the attack to trigger. For example, being in crowded places is a common fear that people with panic disorder share. They don't want to be in a crowded place because the idea of not being able to get out of the crowd when attack is triggered fears them. Similar feelings may arise in lonely and open places where they don't see anyone who could help them if they had an attack. The quality of life is drastically affected because of this fear, and these effects of panic attack could only be avoided by creating a feeling of calmness in the person. If a person has a cure, a remedy with him all the time, he will not fear an attack. Herbal supplements for panic attack are thus highly recommended. A dose of herbal supplement could always be kept in the pocket or purse, so when you fear a panic attack, you could avoid it on the spot. Now, moving on to the diagnosis of panic disorder. Panic disorder often goes misrecognized and is commonly diagnosed as a mini heart attack depending upon the severity of the symptoms. A diagnosis of panic disorder is made based on a full psychiatric evaluation, medical history, physical exam coupled with the laboratory tests. First is psychiatric evaluation. The psychiatrist will ask a series of questions to the patient about himself and the situations and place where the patient is encountered with such attacks. Next is medical history and examination. The psychiatrist questions the patient about personal and health history of the family. He or she will also perform a complete physical examination to check for medical issues that could be causing or contributing to the problem. And lastly, laboratory tests. Although there are no laboratory examinations that can detect panic disorder, simple blood and urine tests can exclude other medical causes of panic disorder. The doctor may also order brain imaging studies, for example, an MRI or a CT scan, in order to look for brain anomalies linked with panic disorder. Now, I will tell you about panic medication. Panic disorders can be effectively treated with a variety of interventions, including psychological therapies and medication, with the evidence that cognitive behavioral therapy has the longest duration of effect, followed by specific selective serotonin reuptake inhibitors. However, subsequent research has shown that psychoanalytic psychotherapy is equally effective in relieving panic attacks as behavioral approaches and has fewer relapses. A psychoanalytic approach that identifies actual but dissociated causes of panic reactions may lead to rapid disappearance of symptoms. The term anxiolytic has become nearly synonymous with the benzodiazepines because these compounds have been for almost 40 years the drugs of choice for stress related anxiety. Low doses of complete agonist benzodiazepines alleviate anxiety, agitation, and fear by their actions on receptors located in the amygdala, orbitofrontal cortex, and insula. Administration of benzodiazepines during a panic attack may result in complete relief from symptoms in as little as 10 or 15 minutes. Benzodiazepines do not treat the source of the underlying fear, but rather offer rapid onset relief from the immediate symptoms. Next, moving on to the side effects of panic medication. In an article by the National Center for Biotechnology Information, it is stated that anti anxiety drugs have been found to have adverse effects. Common side effects of antidepressants include weight gain, upset stomach, nausea, sexual dysfunction, sleepiness, headaches, and more. Benzodiazepines can cause oversedation and lead to addiction. Next is anti panic drug addiction, dependence, and withdrawal. Despite the absence of significant side effects, benzodiazepines are known to be highly addictive and have major withdrawal symptoms. Antidepressants also have dependence and withdrawal issues. When you suddenly stop taking the latter, for instance, you may undergo extreme depression and exhaustion. Symptoms similar to the flu may also be apparent. And lastly is the medication overdose. Medications used to treat anxiety are proven to be safe when taken alone. Large doses also rarely pose any complications. However, combining the medications with alcohol, painkillers, or sleeping pills isn't recommended because the combination poses a lethal risk. Certain groups of people, such as the elderly and the pregnant women, are also prone to serious side effects.
Now, let us summarize what we have learned in this module. Panic attack is an anxiety disorder described by repeated severe panic attacks. A panic attack is an unexpected gush of overwhelming anxiety and fear. It may possibly also comprise of key behavioral changes lasting at least a month and of constant anxiety about the effects of or concern of having other attacks as well. The concern of having other attacks are also known as anticipatory attacks. A full-blown panic attack includes a combination of symptoms like hyperventilation, chest pain, nausea, trembling, numbness, loss of self-control, fear of dying, etc. According to psychological models, although the exact cause of panic attacks and panic disorder are unclear, the tendency to have panic attack runs in families. Panic disorder can broadly be classified into two different subtypes, that is, expected panic attacks and unexpected panic attacks. If the individual suffering from panic disorder is improperly treated or symptoms are ignored, its effects are devastating for both the individual as well as who are around him or her. An identification of bipolar disorder is made based on complete psychiatric assessment, medical history, physical examination coupled with the laboratory test.